Hi, everybody. Welcome to week 6. We are over halfway the course and can see the finish line, so good for you. All right, week 6, spiritual assessment. Some folks really get hung up on this, and definitely some students really get hung up on this, and that's what some of our questions are about this week that we'll be looking at in the discussion forum. And spiritual assessment, if you've been a nurse for a while, you remember the only thing we really used to ask was, what religion are you? So that we could put that on the report for the clergy. So as they came by to visit, they could know what what rooms they should stop into. We've come a long way. You've got some good readings this week, although I think some of them tie more into medical practice, nurse practitioner practice, rather than the maybe bedside RN practice. And I just think about the questions that we ask when we fill out that admission history and some of the things that we ask our patients about. And sometimes folks are comfortable answering, and then sometimes they just don't say very much. I tend to wear a cross all the time. And so some patients who have maybe more formalized religious beliefs, I think maybe feel comfortable talking about them with seeing the cross. I can sometimes sense that. And maybe other patients who don't have as formalized religious beliefs maybe don't feel as comfortable sharing that, but I really try to draw out the spiritual side of people. And some of the questions in the tools that we're going to talk about this week do really help with that. Finding out about where people look to for hope, where do they find support, those sorts of things are definitely very important. I guess the big thing I just want to know from my patient is, how can I support them in whatever spiritual practice they have? Is there anything that needs to go on while they are a patient that needs to be accommodated with their religion or spirituality? And if they're lacking things like support systems, what can we do to help supplement that as we look towards discharge, or as they face hard decisions or hard news as their patients? I guess those are the things that are really the most important to me. And I'll be interested in hearing your thoughts about spiritual assessments, and also trying to convey to students the importance of spiritual assessments. It is a little challenging sometimes, but it's interesting, some of the conversations that you get into with students about spiritual and religious issues when we start touching on that topic. Some of the most interesting things come up in conversation. And I think some of this really does start with knowing your own beliefs and being comfortable with your own beliefs. If you're comfortable in your own beliefs, I think you can be more open in discussing those types of topics with patients and family members and things like that. All right. So like I said, we do have some good readings this week, but some of them focus more on the medical side. So I'm including an article, Spirituality in Nursing Curriculum. And it's a discussion about, well, it's a study about different ways to incorporate the subject of spirituality into our nursing curriculum. And do we thread it through? Do we make a course out of it? What's the deal? Well, this is an article about how one school focused on that and what their results were. So I'll be interested in seeing what you think about their approach, and maybe what your experiences have been with the discussion of spirituality and religious issues in your own BSN program. I would be interested in hearing that. Okay, so week 6, spiritual assessment, and I'll see you in the main forum.